Patello-femoral pain is characterised by deep diffuse pain in and around the front of the knee, and if it's not treated can last for several months. So let's have a look at some of the factors that may well contribute to patello-femoral pain. And let's start by looking at the anatomy of the knee joint. So the first articulation is between the femur and the tibia, and this bends and straightens, flexes and extends. However, we're focusing on the patello-femoral joint, and this is the articulation between the patella, or the kneecap, with the femur. And you can see the groove here from which the back of the patella articulates up and down. Now, the job of the patella is to transmit the forces onto the tibia to allow the quadricep muscles, which are the big muscles at the front of the thigh, to extend the leg. Now, if these muscles get tight, it could cause a compressive element at the patello-femoral joint, leading to pain. And people with knee pain often complain of their symptoms being exacerbated by sitting down with their knee bent for long periods of time, or standing up after sitting down for long periods of time. However, one of the other biomechanical factors that can lead to patello-femoral pain is weakness or inefficiency of the gluteal muscles. Now, the gluteal muscles, they articulate at the hip joint here, and they cause a rotation at the hip joint. And they come from the pelvis and insert onto this bony bit here. Now, if they're not very strong, the femur can sometimes rotate inwards, and then that changes the angle of the groove for the patella to articulate up and down, and can lead to pain, patello-femoral pain syndrome. So I'm going to show you some exercises now to maintain or strengthen these gluteal muscles up. And so the first one is the clown exercise. And so laying down on your side with the affected side uppermost, knees bent to 90 degrees, hand on your hips so that you can control your hip joint here. And then all you're going to do is just lift your knee up as far as you can do, and we're getting a good contraction of the deep gluteal muscles up here on the upper side, and slowly back down again. Up, hold, and slowly back down again. You can hold that for up to 5 seconds and repeat that 5 times. To progress this exercise, a nice straight leg with a slight bit of upward rotation, and then take the whole leg up, hold it there, and then slowly back down again. Up, hold it there, and slowly back down again. So these two exercises are designed to strengthen that gluteus medius muscle. However, we also need to put it in the context of function. So one of the great exercises is to just stand with the affected side uppermost, and making sure we've got good alignment from the hip through the knee down to the ankle joint. And then from this position here, we can just slowly bend and straighten the knee within the pain-free range, ensuring that we've got correct alignment and good activation of that gluteus medius muscle on the front leg.